Good afternoon, everybody. Welcome to the first exec scrutiny of this current administrative year. It's Wednesday the 14th of June, it's 4 o'clock, and we're in the council chamber. So I'll go straight to the agenda. Any apologies?
Chair, I've got apologies from Councillor Eyre.
Okay, and I think everybody else is present, yeah? Any late items? I don't think there are any. I don't think we have any positions. Urgent items to which calling will not apply. Okay. Right. Declarations of interest we'll do then. First, any declarations on the agenda?
Can I raise a matter of interest?
Yeah.
As to, it's been my understanding that all our committees that meet in the evening start at 6 o'clock. Can somebody say why this is 5 o'clock? Because some councillors find this inconvenient.
I wasn't party to the decision, but my understanding at the time it was changed from 6 to 5 was to do with the length of the meetings, that some of them were happening the time it was finishing, and the committee or the board decided they would start at 5 o'clock. That was my understanding. I don't know if there's anybody else knows better than me on that subject. Lucy, do you remember?
Yeah, we were asked as to whether we wanted to start at 4 or 5. I think primarily because there was a desire to get to football matches that started on Tuesday evenings. It wasn't my priority.
I'll maybe cover some of this off in a minute, Sarah, with something I want to raise of interest myself anyway. Jenga. Okay, could you, when you're speaking, remember to press your button? The public can hear you better then.
All right. Yeah.
Okay, well, I might as well deal with it now as a matter of interest, because we're obviously a new scrutiny committee, and there's a number of issues, like the 5 o'clock start, but also the fact that we traditionally, up till now, the meetings have been held on the Tuesday before the Wednesday cabinet, which makes a lot of things quite rushed. The papers come out a week in advance. The officers have to write up any recommendations and distribute them prior to any cabinet meeting. If there was something that came up in exec scrutiny that needed work, there wouldn't be time to do it before the actual cabinet meeting. So I was going to put it to the board, to the question as to whether the current arrangement is the right one. Also, in relation to the constitutional review, I know that the officer that ran that suggested that the timing of the exec scrutiny prior to cabinet was impractical and suggested it should be done before the Tuesday. And I just wondered people's thoughts on, and if timing's an issue, then we set out how we intend to go on from the beginning. Then we'll go from there. We could hold the meeting any time from the Wednesday prior to cabinet onwards. Yes, Sarah.
Yeah, I think you've just mentioned the point I was going to raise. Clearly we can't meet till we've got the cabinet papers out. No. So there's a week in advance, but I see what you mean. Traditionally, we meet the night before cabinet, and then there is not really sufficient time if we wanted to investigate anything to get it to cabinet for tomorrow, for instance, if we find something here. So I agree with what you're saying. We need to have it earlier. And by that I mean days, a few days earlier. And also I'd like to propose that we go back to 6 o'clock. So there's 2 points really. The timing in relation to cabinet tomorrow, it is too soon. We need to put it back. And 6 o'clock, I think we should go to the timing of the start.
So we'll deal with the two issues separately then. So the timing first, 5 or 6 o'clock for starters. Those in favour of 6. And those that want to do 5? Well, the 6s have it by the look of it. So we'll go for 6. Alex, is there any potential problem with changing the day of the exec scrutiny clashing with other days and cover from officers and things?
I think in principle there are no issues in meeting, exec scrutiny meeting earlier. As you've already alluded to, the cabinet papers for a Wednesday cabinet meeting would normally be published on the Tuesday of the previous week. So executive scrutiny could meet at any point from the Wednesday onwards. I think we will probably need to take away the action to look at how it would interact with the schedule of meetings more generally. So other scrutiny boards do tend to meet on a Monday evening and sometimes a Thursday evening for licensing and planning committee as well. So I think we would need to look at how the schedule interacts with those, but as a point of principle, there's no reason why this board couldn't meet earlier.
So if we take it away, then sorry, go on.
Just as part of those considerations, Chair, I think we also need to make sure that members of this board have time to read the papers from Cabinet before we have to talk about them at our meetings. So to hold it on the Wednesday, a week before Cabinet, would mean that we've all got to have time to read the papers, which can sometimes be quite lengthy between when they come out on Tuesday and the Wednesday evening. So I think that needs to be considered.
Yeah, you make a valid point. I think, to be honest, practically, Thursday or the Monday would be the best option. You'll have a chance to read them and have a chance to do something with them before the actual scrutiny. So if you can leave it that, we'll take that away, Alex and Stephen, and look at how it reacts and complements or otherwise the other meeting agenda and the resourcing of it. And then we'll notify any changes to the dates, but we'll revert to 6 o'clock from now on. Yeah. Is that okay, Alex? Yeah. Okay. So, declarations of interest. Are there any declarations first? No. There's the minutes of the exec scrutiny held on the 11th of April, which are electronically attached. Any issues? Any comments? Queries? Alterations? Thank you, Lucy. Seconder. Thank you, Phil. Okay, forward plan then. Any comments on the forward plan? There was one issued today, I think, in relation to being the latest one. Lucy, do you want to come in?
Chair, I was interested in the item, which isn't a new item, but it's been there for a while, on Project Assemble, which it says that the earliest date the Council Cabinet will consider is the 13th of September this year. Now, when it originally went in July 2 years ago, there wouldn't have been much to look at. But I think by this stage, there may well be some preliminary work that officers have done, and we should be able to scrutinise it. It suggests here that it's an exec scrutiny board responsibility, and I'm just wondering whether other members would also be interested in looking at that in more detail at either the next or the following meeting.
Okay, good point. We picked up on that. Jamie, did you want to?
No, I was just going to say that I agree with Councillor Kerr. I think it'd be quite good if we could have a look at that.
Can I make an observation? As we set our stall out from the beginning with this committee, with this not a committee, it's a board. The forward plan, done right, can be a very useful tool, provided it's up to date and with sufficient detail on. The current updates on 3 things, I think, but what struck me, knowing what is in the pipeline, is there are a lot of things that aren't on the forward plan that should be, because the value of the plan is to give us as an exec scrutiny and the other scrutiny boards the opportunity to identify things to scrutinise and the best time to do it. And the example of Project Assemble being September is a good one, because that seems a fair way off, and maybe we should look into that. So, Alex, I don't know who best to raise the issue of the content of the forward plan with. I know it's what's the name that does it? So I'll give you an example or two. The combined authority. We know that there's paper coming in relation to the combined authority and an update in that. There's nothing on the forward plan. There's nothing in relation to the council constitution, although that may not be a key decision. There's nothing in relation to the Strategic Partnership, City Centre Strategic Partnership Board, and there's nothing in relation to the budget. So I think it just needs a little bit of forward thinking. We know it's, and that's just off the top of my head in relation to things that are coming down the pipeline and should be entered into the forward plan.
Thanks, Chair. Yeah, I think that's a fair challenge. Some of those examples that you've listed wouldn't necessarily be key decisions, and as you've alluded to, it's only key decisions that are included in the full plan, so we're required to give a minimum of 28 days notice of any key decision that the Council Cabinet is due to take. We try to work with officer colleagues across the organisation to ensure that as soon as it is known that it is reasonably likely that a key decision will be required, that it is entered into the full plan with as much notice as possible. On those specific examples, we'll have to take it away and ask the officers involved. Add to the full plan in its next iteration if necessary.
Thanks, Alex. And if we can sit down and decisions and get, we know where we're going. Lucy, you want to come in?
I'm just going to strongly support what you said, Chair, because it's something that I've raised from the other direction a number of times over the last year, where we've had an item that has both appeared on a local plan and been considered at the first occasion that we've had the opportunity, or possibly 1 month later. And that gives no opportunity for one of the other scrutiny boards sometimes to actually include that on their agenda because they don't meet as often as this board.
We're getting some feedback. Somebody else got one on?
It's mine. Thanks, Chair. Could you say a little bit more, Alex, about how items are decided, how decisions are made about what is included on the forward plan? Please.
I think there is an expectation on senior officers to notify Democratic Services when it is considered reasonably likely that the Council Cabinet will be asked to make a decision that constitutes a key decision in our Constitution. So that is any decision which has a financial impact, cost or saving in excess of £250,000 or is considered to have a significant social, environmental or economic impact on residents living or working in 2 or more wards. Now, that second one is sometimes a slightly subjective assessment. Ultimately, what is and isn't a key decision is a responsibility that rests with the monitoring officer. But as I said, there is an expectation that service directors and heads of service across the organisation, when they know there is a key decision that is likely to be required within their areas of responsibility, there is an expectation that they would then notify Democratic Services, complete what we call the forward plan template, and then in the next iteration of the forward plan that is published, that item would then appear. There are certain circumstances where it might not be possible to give the full 28 days notice, and there is a constitutional process that exists to grant waivers, but that requires the permission of Councillor Polster as the chair of the Executive Scrutiny Board, where we haven't given the appropriate notice period of a key decision. And I think it's something that perhaps I could pick up in training with councillors outside of this meeting, if that would be sensible.
Thanks, Alex. And actually, there's an example of a waiver that's been allowed for today in relation to the financial matters, the confidential matters in relation to the council optimisation later on today. But as I've said out to officers already, I want us to be on top of things with the forward plan, with the papers and things, and I don't want to be asked for waivers and exemptions along the way. So hopefully we'll set our stall out in that way as well. So whilst we're at this and changing everything with the Exec Scrutiny Board, I just want to raise one other thing, and it's related really. And the example I'm going to use is that of Project Assemble. When I was last on the Exec Scrutiny Board here, we had the monthly meeting and that was it. There was no project work or case work or work to do a deeper dive into any particular subject. But with a a good forward plan, then there's the opportunity there, I think, to pick items off of that forward plan to be able to do a deeper scrutiny of prior to the papers coming to council, because it almost, the way it works, of course, is that the papers come to exec scrutiny immediately before they go to cabinet. So in a way, it could be argued the decision's been made, and we ought to be, if the other executive scrutiny, or the other scrutiny boards haven't looked at it, then things are going through without a chance to have an impression on that paper. So, Alex, is it, again, resources-wise and practice-wise, is there any reason why the exec scrutiny board couldn't pick a topic to review from the forward plan in advance of it coming to the exec scrutiny fully?
No, there isn't. I think in the past we have had this board has had responsibility for examining corporate performance. So there are examples of areas of identified underperformance for the council where this board has requested an update is provided in a standalone report to this board that sits outside of the cabinet papers that you scrutinise on a routine basis. The other option that is available for this board is that you can recommend to the other scrutiny review boards to undertake reviews of particular topics if there is that need for a deep dive into a particular subject. But if you think that it is sufficiently significant or cross-cutting that it warrants the attention of this board, there's no reason why a standalone report on a particular issue couldn't be brought to this meeting. Obviously, it's for yourself as the chair, along with the committee members, to manage the time that's allocated to this meeting and make sure that everything that's within the terms of reference are given appropriate time. So sometimes it's challenging to balance the scrutiny of the cabinet agenda alongside those deeper dives, but there's no reason why you couldn't do that if you were so inclined.
If it was really necessary, we could call a separate meeting.
Yes.
Okay, with that in mind then, subject, because Project Assemble, for example, what scrutiny board would that fall to? I noticed in the forward plan it says exec scrutiny, but I would have thought it would have been regen or...
I think the reason that it refers to executive scrutiny in the forward plan is because it is cabinet that will take the decision, and therefore by default executive scrutiny will look at that decision when it comes to cabinet, but the most appropriate board, in my opinion, would most likely be the Regeneration and Housing Board, I suspect. Okay.
So, members of the board, is it okay if I suggest that we recommend to the Regen Board that they look at Project Assemble in advance, and if they don't choose not to or would rather us do it, then I'd be happy for exec scrutiny to take a deep dive into that project in advance of the cabinet paper. Can that be agreed? Alex, can you arrange, or can we arrange for the chair of Regen to be asked about that?
That's fine, Chair. The process would be that an extract from the minutes of this meeting would be passed to the Democratic Services Officer who administers that scrutiny board, and then the chair would be consulted and it will be discussed at their work programming meetings that are taking place at the moment for the forthcoming year.
In the meantime then, members of the board, if there are other, once you get to look at the forward plans as they emerge, if there are items in there that you feel we should take a closer look at, then by all means bring them to me or let me know in advance, or bring them to this meeting, and we'll make sure we are effectively scrutinising these subjects. Yeah? Okay, good. So I think that deals with the forward plan, unless there are any other issues on there, which we can move on then to item 6, which is to consider the council cabinet agenda. Right, we'll do that. So the usual first items, apologies, late items, receipt of petitions, and the first practical one is item 7, which is where it will receive, where cabinet will receive any recommendations from us tonight and go from there. Then there's item 8. Anything on item 7? Hopefully we'll do the same as we've done traditionally and deal with each of our recommendations at each item of the council cabinet.
Chair, if I may, I could just, sorry, Councillor, I just wanted to just briefly say on that point, if, like Councillor Kerr, if you're able to, some members will type out their recommendation and email it to me. We've got a form of wording then. That's not always possible. So I've also got here, which I can hand out, just want to indicate so that you can just write down while you're having a thought of what your recommendation is you want to put to the board. If you, just to put it simply, if you can get somebody to second that recommendation, then we'll go to a vote. And if that vote's carried, that recommendation will go forward to the Cabinet meeting. Thank you, Chair.
Okay, thank you. Yeah, sorry, Matthew.
Yeah, oh, there we go. Previous administration extended an invitation from the Chair of Executive Scrutiny to present the recommendations. Do we know if the current administration has extended that invitation to you to attend?
I haven't had a direct invitation, but I've made a presumption that practice will continue. Alex, has there been any suggested change to that practice?
No suggested change to that practice. I think it's become our custom practice that that's what will happen, but we can clarify that point with the leader of the council if you wish.
Right, so item 8 then is the minute extract from council on the 24th of May, and there's a list of 4 items there particularly to note. One I've sort of covered off in relation to the constitutional review and potential suggested changes in the way that we operate exec scrutiny on the back of comments made by those doing the review that the system of scrutiny and cabinet needs to be reviewed and looked at, but that will come in due course. Whilst it might not be a key decision, Alex, I think it's something, constitutional review in relation to that is something that should be brought here for us to consider any recommendations of the people that's doing it. Yes, Lucy.
I was going to agree with you, Chair, that it's certainly something that should be given some scrutiny, but I wonder whether it should come under the remit of the Audit and Governance Committee.
Alex, do you know where it's intended to take it first?
I think fundamentally alterations to the Constitution are non-executive business, and so therefore it wouldn't be a decision that would ordinarily come to the Cabinet or a Cabinet member to propose alterations to the Constitution. What has been agreed is that previously, through resolutions of Council, is that in the development of the constitutional review, a working group, cross-party working group of councillors will be consulted prior to any formal decisions being sought. As some councillors will already be aware, we received the initial report of the Centre for Governance and Scrutiny shortly before the elections. There is a process happening at this moment in time to draft initial revisions to the Constitution based on the feedback for the Centre for Governance and Scrutiny. Once that work's been completed, we're proposing to take that to the cross-party working group. There is nothing that precludes a scrutiny board from looking at a non-executive matter. So if you did want to examine that in a formal scrutiny setting, it could come to a scrutiny board. Equally, the Audit and Governance Committee would be appropriate as well. That has that overarching remit for governance and constitutional matters, I suppose. So it's really at the discretion of each committee as to where that scrutiny of that topic would go.
I guess the way forward might be for the board to be notified of any proposed changes and then react accordingly, take it and deal with it accordingly. If it's agreed, it's agreed. If not, we can discuss it, yeah?
Happy to do that once that initial work's been completed.
Okay. The other things to note from that full council minute, has the working party been refreshed, the working group? So there were people who retired and come off it and whatever?
Not yet. It's on my list of actions to complete from the last full council meeting. Okay.
And then it's to note that the monitoring officer will have some constitutional changes to do along the way, and she's been authorised to do that. But the last one is quite interesting in relation to request that Cabinet alter the allocation of devolved neighbourhood funding to account for the creation of 2-member wards as detailed in the thing. Basically, the recommendation is that, as was proposed previously, that £5,000 per councillor is allocated. So in a 3-member ward, there'd be £15,000. In a 2-member ward, there'd be £10,000. Is that something we can endorse, do we think? Yes,
Yeah, no, I think it'd be great if this board could endorse that specifically and recommend to the Cabinet that it's kept at 5k per councillor per annum, because I know I'm getting badgered by residents already and they're really keen to see that kept.
Okay. And the current recommendation is that that's maintained across all 17 wards, so all 51 councillors would retain a £5,000 interest in devolved funding. Is that okay, Alex?
Yeah, that's my understanding of what has been proposed. The majority of that minute has already been agreed by council. That final bullet point in relation to the allocation of ward funding is executive business, and therefore the full council is asking the Cabinet to make that change. So that will be decided upon tomorrow.
Matt?
Thanks, Chair. Just to add to that, I'm sure it's not the last time I'm going to be saying this, but I think we also should be telling them how important we feel neighbourhood funding is, devolved funding is for ward areas. It's a relatively small amount of money, but it does so much in our wards, and it's something which we've held very close to our hearts in terms of our political stance really on it. And I think that we need to be very clear that we feel that money should remain, that money should be £5,000 per councillor, and also it should be fair and equal across wards. So if there's some kind of extra thing we can say to ensure that the current administration know how strongly we feel about that, then I would support it, Chair.
That's the practice is that we can put a recommendation to that effect. Matt, do you want to have a go at drafting something?
Yeah, I can do that.
Stephen can, we can go through that in a little while. Yes.
Thank you, Chair. Yes, as a member from a 2-member ward, I think that is a fair way of doing it. I think it would be rather unfair because of the population is smaller. It's the right thing to do, and because of it, the way it breaks down, it's fairly easy to settle on that 5k figure per councillor. So I would support that, Chair.
Okay, good. Good. I think it's certainly something we can endorse. So let's get back.
Chair, if I may just interrupt here. Sorry. So it looks as if you wanted to make a recommendation to Council Cabinet, which we need to firm that up now, get a seconder and then go to a vote, and if that's carried it will go forward. So it could simply be that you that the board endorses the fourth recommendation, the fourth resolution, sorry, and that you agreed that it should remain at £5,000 per councillor. It could be as simple as that.
Across the 17 wards and across the 51 councillors. Have you had a chance to draw anything up?
I can write it now.
Sorry?
I can write it now if you want.
If you would, and then say, Stephen, then, because we're going to have to vote, we're going to put it as a recommendation. We're going to have to hear it, or the gist of it at least, and then vote on it and accept it or not, or otherwise.
Okay, so recommend to Cabinet that the £5,000 per councillor per annum across the 17 wards and all 51 of us is maintained going forward. Something on those?
So
are we all happy with that wording? Yeah.
So to endorse the item 4, the resolution number 4, and recommend to council that the devolved funding of £5,000 per councillor across 17 wards and 51 councillors.
It's 18 wards, Chair, now.
Sorry?
18 wards now, Chair.
Oh, it's 18 now, Custard. 18 wards. Is that all right, Stephen?
Yeah, so we've got that then. So it's the £5,000 per councillor per annum across 17 wards being maintained going forward for all 18 wards, excuse me, for all 51 councillors. So if we've got a second, then we'll just go to a vote.
Councillor
So
Ingalls
all
to
those
second it.
all those in favour?
Okay. Unanimous.
That's carried then, Chair. Thank you.
Okay, good. So, turning to the agenda, item 9 in the Derby and Derbyshire Integrated Care Strategy 2023.
Thank you, Chair. That's me going to
You're
cover.
hiding behind somebody bigger
Yes,
than you.
hiding at
Sorry,
the
I
back.
couldn't see you.
Thank you. So I suppose just start with a note for the board that the item is being brought on behalf of the Integrated Care Partnership. And if I start by just giving a little bit of context of the strategy and the structure in which it sits locally. So the Integrated Care Strategy sits across both Derby and Derbyshire, so covers the area entirely. The purpose of the strategy is to set the direction for the local health and care system, aiming to deliver more joined-up, preventative and person-centred provision and responding to population health need and health inequalities. And it's aiming to focus on issues that will benefit from, I suppose, cross-Derbyshire and cross-system consideration and effort, so particularly focusing on those areas. The development of the strategy is the responsibility of the Integrated Care Partnership. And just to note that the Integrated Care Partnership is a statutory partnership under the Health and Social Care Act, and it's a joint committee. So it's a joint committee of Derby City Council, Derbyshire County Council and Derby and Derbyshire Integrated Care Board, and it's chaired by the relevant portfolio holders of Health and Wellbeing Board chairs, so he's co-chaired, and the vice chair is the Integrated Care Board, and it's currently hosted by Derby City Council, so it's held in this very room. So just on the Integrated Care Strategy itself, so it's been developed involving colleagues from across health and care partners, and that's including the council. The strategy itself has been reviewed by the Integrated Care Partnership in April, and it was supported by the partnership, and it put forward the recommendation to come to Cabinet for its approval for publication, hence it's here today. It does aim to align and complement the health and wellbeing strategies of both Derby and Derbyshire, so the priorities and objectives within those are reflected within the Integrated Care Strategy. And again, also to note that it is underpinned by data and intelligence and the understanding of our local health, population health needs through the Joint Strategic Needs Assessment. I think also key to note is that it's not intended to be a static strategy, so as we kind of develop locally and kind of, I suppose, grow into mobilisation and kind of joining up better, the anticipation is that the strategy will grow and develop with it as we grow. In addition to the full strategy, which you'll see is quite significant in size, there will be a shorter version which is intended also to be an easier read and more accessible version, and there is a draft of that currently, so that will be published alongside the full strategy. And I won't take you through obviously the strategy in any detail. I think probably key points to pull out for note of the board, I think, are primarily in sections 3 and 5, which essentially kind of give the focus and kind of primary purpose of the strategy. So the key areas of focus are set out in section 5, which are around Start Well, which will be focusing on school readiness. Stay Well, which is focused on prevention and early intervention in relation to three main causes of ill health and early death, and also health inequalities. And they are circulatory disease, respiratory disease and cancer. And then finally, Age Well and Die Well, which is aiming to enable older people to live healthy, independent lives in their normal place of residence for as long as possible. And then also kind of a focus on the key drivers of those areas, which relate particularly to, for example, smoking, healthy weight, physical activity, harmful alcohol use, child poverty, mental health and emotional well-being, housing standards and air quality, again, which are reflected in our health and well-being strategy. I suppose finally to note that the recommendations are set out there in 2.1 and 2.2, which I won't read out. They're obviously there for you to see. So I'll stop at that point, Chair.
Thank you very much. You covered that very succinctly. You covered what is an awful lot of work by an awful lot of officers that goes into this and other boards, which is crucial. Is it, just remind me, is this annual strategy, is it an annual strategy or is it reviewed in a different period?
So I'll have to check on that. I don't think it's got a set period, but I think it would be certainly in place for longer than a year, but with review points along the way to update and develop it accordingly, as I said, as we grow and develop. So it will be a moving feast, yeah.
Okay. Right, well, I mean, obviously it's a very detailed, comprehensive report. I think the first thing is to say we should note and thank the officers for the comprehensive nature of it and the work that's gone into it. It sets the basis for everything that we do in those terms. So that's good. Any questions, queries? Yes.
Yes, thank you, Chair. Yes, it is indeed a comprehensive report, and thank you very much for that. And I think it captures the essence of what it is we're trying to do in terms of integrating health needs, social needs, etc. You highlighted that this is an organic document, and I think key to any organic document is the centrality of reviewing and evaluation. And evaluation is actually cited in the document as part of the delivery of the strategy, particularly point 418. And then I also looked at section 8, which gives an essence of the form of the actual evaluation process. What I don't get from this in terms of that, because obviously the strategy is organic and we're constantly wanting to improve what we offer in terms of services to people, I don't get a sense of when that evaluation will take place. And a synergy with that evaluation is the mention in that of engagement. So are they separate things, or is part of the engagement process? Will that also feed into the evaluation? Thank you.
Thanks, Cecile. Alison, these things are dealt with in various places. Did you want to comment on the question?
Yeah, thank you. And you know, I didn't pick up the evaluation, but I can confirm there's a specific working group that is looking at the evaluation framework, and I think in reality it's probably going to be a range of evaluations. We're looking at something that is very complex, so there will be components which will look at the key areas of focus specifically and the outcomes that we're looking to achieve within those, and I think there will be short, medium and long-term goals within that. So we're looking at services, but we're looking at kind of actually how we're people experiencing that provision, and are we making a change and a difference in terms of how people experience provision, but also how and their access to it. But alongside, I guess, the delivery of the key objectives of the strategy, we'll also be looking at actually, are we can we measure a change in integration, collaboration? Do we have more succinct governance arrangements and decision making, which we're kind of working through what that will look like, and we are working with people like the Local Government Association in relation to that. So I think it is very complex, but we've got a range of different kind of expertises kind of linked into that and supporting that, and I think some of that we will be able to get on with an action very quickly. I think some of it will take a little bit more time in terms of developing the right evaluation strategies and approaches to make sure that we are delivering what we're intended to do.
And of course there are a number of other forums, the Health and Wellbeing Board, the Integrated Care Partnerships, and people can deep dive into any particular aspect of evaluation, yeah? Does that answer your question, Councillor Wright?
Yes, it does, but I just wondered under recommendation whether we should add something about evaluation as part of the efficacy of the strategy.
I wouldn't be opposed to that, but we need to come up with the wording of what it is that you want to, that you'd want to recommend. Whilst you have a think of that, I'll take Councillor Kerr.
Thank you. The thing that struck me about what is otherwise a very thorough and I think really good, sets a good ground position for this document is the way it pretends that there is no private sector involvement in health or health development and improvement within the city and the county for that matter, because a lot of people will belong to a gym, which is obviously to do with health improvement. They belong to Slimming World or to Weight Watchers. They participate, they go and see a physiotherapist if they can't get somebody soon enough. Even the council enables people to access those sorts of services and counselling services as well, rather than necessarily being limited to public sector services for their health provision. And I wondered why this wasn't included, why we're not looking more broadly at the whole of the offer of health support, health improvement, and even the acute side of things, because we've got Nuffield Hospital in the city as well. And I just wanted a bit more background. Is that something that has been excluded as part of the way in which the government expects this document to be written? Or is there some other reason why we are looking very predominantly at the public sector with a touch in on the voluntary community and social enterprises, but there isn't much of that in comparison? I've also got a specific question, Chair, which I might come back to on the our Derby and system page. Would you like me to pick that up at the same time? Thank you.
Alison, I suspect we try to deal with in this with things that we can directly affect and that we directly do. Is there any reason why it couldn't be extended to private offer, etc.?
And I think that would be part of the intention of the strategy, so that I don't think there's a deliberate exclusion of kind of the business sector. I think the initial focus has been on those services and provisions, and as you say, particularly working with the voluntary sector, probably in a way that we haven't done previously, to start to consider, well, I suppose, getting our own houses in order, because we know that there's significantly more that we can do in terms of integrating and developing those the services that we have in what is a very complex health and care system. But I think the system as a whole is very open to, I think, innovative and different ways of doing things and providing services, but also looking at actually where services as such in a formal sense are the appropriate means, and sometimes that might not be the case. So I'll take away Councillor Kerr's point, and I can feed that within the system as part of, and definitely as part of the implementation, and particularly as we develop the strategy going forward, and just say that I don't think it's a deliberate exclusion. I think it's just kind of starting on, I guess, the centre of the onion as we work out
So if you could take that back as feedback from the board through
Yeah,
Councillor Kerr, that would
absolutely
be
can.
appreciated. Yes, Lucy's second point.
Yes, Chair, I have a recommendation that would allude to that, which might strengthen if people want to support it, strengthen the suggestion that we should be looking at in that direction further. My second point, Chair, though, was on page 8 and 9, we have the graphics on our Derby and Derbyshire system. And if this isn't fully published yet and there is any scope for tweaking, I actually thought in terms of the bottom left-hand corner of that spread on population change, it's actually not so useful, certainly to my mind, of looking at a percentage change in population from 2021 to 2011 to 2021, than to know what the actual population is of different age groups with the breakdown between Derby and Derbyshire. And if maybe there could be further consideration as to whether a different graphic would be more useful for general information on that point. There's on page 8 and 9, there's the Our Derby and Derbyshire system, which you might be able to see like that. It looks like that. And this bottom corner here has a change of population so that we know that the number of people who are over 90 has grown by 30% between 2011 and 2021. But what's the actual number of people, I think would be more useful. So it's page 8 and 9. It says 8 and 9 on the bottom. It's page 5, yeah, depending where you read it. Yeah, it's page 8 and 9 of the document or page 5 of 41. No, I haven't got a recommendation on that one, Chair. That's just something for officers to think about. The recommendation wording is to ask Cabinet to consider raising the possibility of including more elements of private healthcare service provision in the discussions and future writing of the integrated care strategy by inviting some private providers to join the integrated care partnership. Would you like me to read that again? To ask Cabinet to consider raising the possibility of including more elements, because there's one, of private health service provision in the discussions and future writing of the integrated care strategy by inviting some private providers to join the integrated care partnership.
And it would be, I guess it would have to go to the integrated care partnership for its consideration of changing membership and kind of then the appropriate change in terms of reference.
It's wider ranging than it sounds in the initial phase. Yeah, because it could get too much private. Stuff could get in the way of what it is we're trying to do as well. Maybe I think
it's, Chair, the way I've worded it is to try and make it up to nudge Cabinet to consider it without expecting them to do everything. So it's to consider raising the possibility by inviting some private providers. So it's not saying everybody's in, it's just to say, let's have 3 or something. If
your intention is to get officers and Cabinet to think about that and weigh up whether or not it's something that's good or not, then I can live with that. But I think they may have some issues. Changi, you wanted to come in?
So how would you pick and choose some private?
Me personally, I would invite people to put themselves forward and say we're going to have 3 or 5 and get somebody to assess it. But I'm not determining here how you would do it. I'm just suggesting that there should be a way in for the private sector to contribute to the way in which we provide health services to our population.
Okay. I'm not sure it's workable particularly. Jamie?
No, I was just going to say, I understand where Councillor Kerr is coming from, but yeah, I think we need to tweak the wording of this.
Happy to tweak.
But yeah, if we tweak it correctly, I'd be happy to. So I understand where Councillor Kerr is going with this, and I think it's a good idea. But the wording for this is going to be crucial because it's otherwise we're going to look like we're.
We shouldn't really tweak it after tonight. We need to have a firm recommendation that we either agree or we don't agree with. So,
Do you want to talk about Cecile?
I've got a form of wording to add to the recommendations, to ask the Cabinet to add the following. The development of an appropriate and timely evaluation process for measuring the efficacy of the ICP strategy.
is everybody okay with that?
You want me to read it again?
Just one more time, yeah, that's okay.
Yeah, this is basically to ask the Cabinet to consider adding this particular sentence to the recommendation. The development of an appropriate and timely evaluation process for measuring the efficacy, so how effective, efficacy of the ICP strategy.
Everybody okay
So,
with that
how
one?
effective is it?
Do we have a seconder? Councillor Khan will second it. Those in favour of that? Any against? Okay. If you can supply Stephen with the exact wording when perhaps we got it. Okay.
To ask Cabinet to raise the possibility of including more elements of private healthcare service provision by inviting some private providers to join the Integrated Care Partnership so that they can join the discussions and future writing of the Integrated Care Strategy. In fact, I'll take that bit away then.
Turn the mic up. Mic's still on, the mic's still on.
Yeah, I would have.
I was just reflecting, Chair, and I suppose just a query on the report itself is regarding the integrated care strategy and its approval for publication, and I just wonder if the issue raised by Councillor Kerr is more of a issue in relation to the integrated care partnership as a structure and body. So I wonder if it's a slightly separate thing. I mean, it's not to say we can't take that through to the ICP and kind of raise that as an issue.
It comes up at this point because there's the talk about the review and the revision of the integrated care strategy as a living document. And as part of that document's evolution is why we would want to have all of the different elements within the care sector to have access to that revision and review. So we have further shortened it, what we're proposing, but it's so that we can join the discussion and future writing of the integrated care strategy.
Okay, I think it's right to raise it with the body rather than as part of the strategy, but I have difficulty with in relation to it being some private providers. You're entering into a difficult position there because for me it's either all or whatever, all or none. Martin, you want to come back?
Yes, I was just going to agree, Chair. I would have some concerns about that. If it was sort of a gym or something that happened to be in the private sector, then that's fine. But if you're talking about companies that are potentially going to be bidding for contracts to take over the running of health care services, then they're potentially going to get access to information which puts them at an advantage. And I'd imagine you'd be getting into all sorts of contracting problems if you were to go down that route. So I don't think I'd be able to support anything quite that vague, I'm afraid, Chair.
And we could still take it back in other ways, couldn't we? And go from there.
Chair, I just sort of keeping this thing in proportion. We're not making policy at this meeting. We're suggesting a direction of movement. So to turn what I've proposed here into reality, it'll have to be written up, and someone's going to have to review it, and someone's going to consider how we invite and what mechanism that invitation would form, whether there would be any limitations on who some private providers might be. And all
I get that,
is
Lucy,
not
and
specific.
I get that, and I get what you're saying is that we could raise it as an issue for something for them to think about. But there's different ways in which we can make representations, and different ways, different appropriate junctures at which to make those recommendations. So I'm sure Alison can take the gist of it back, and if it's an ICP thing, then it's an ICP thing. But I think Cabinet would struggle. I can't imagine Cabinet agreeing to the vagaries of that. So let's put it to a vote anyway. Lucy recommending that. Is there a seconder? Yes, Councillor Mulhall. So a vote. Those in favour? Those against? Okay, that's lost, Lucy. We'll make sure it goes back anyway, but we'll take it from there. Right. Moving on then. Anything else to say in relation to the this particular item? Yes.
Thank you.
Martin.
Thank you, Chair. I've got quite a general question, maybe a daft question, but I'll ask it anyway.
Never daft.
Is there any additional funding from central government that comes alongside this strategy? And in the unlikely event that there isn't, does it place additional responsibilities on the council and our services and our budgets? And if so, what sort of thought has been given to how we might take on and any additional responsibilities that might come along with the plan?
I'll defer to Alison, but I mean, I don't know of any specific funding streams for this, but there are obviously fundamental funding changes with the changes that are going on in this sector. Did you add anything?
That is quite a simple answer in that there's no specific funding in relation to the integrated kind of delivery of the integrated care strategy or the integrated care partnership. So there isn't an additional funding stream specifically for that. I'd suggest that there wouldn't be additional expectation, I think, on the council or other kind of partners within the system. I think it's looking at how do we work better together and potentially deliver differently within the resources that we have. That notwithstanding, I think it is recognised within the strategy that I think pretty much all the partner organisations that are party to the strategy are in a challenged position, but also recognising that actually to move forward from that, we need to start to actively tackle some of the issues that are raised in the strategy to start to kind of reduce demand going forward, but also kind of improved outcomes and services for kind of local people. So yeah, in short, there is no further funding, but I think it's looking at how we use our existing resources differently rather than additionally, if that makes sense.
And if I'm not mistaken, it's a long-term statutory requirement for an integrated care strategy that we've had for a long while. Yeah.
But the integrated care strategy and the requirement for that came into effect with the development of the integrated care system. So effectively from July of last year. So the requirement for an integrated care strategy across the patch that it is a new requirement, but it is a statutory requirement. So we don't have a a choice of whether there is one or not.
Thank you, Chair. Just a couple of questions, actually. One for Alison first. On page 56, there's a case study, the medical consumables at home. It talks about picture prescriptions due to some families in Derby City not speaking English. You know, the disadvantages these families experience must go well beyond prescriptions and that kind of thing. Is there any other work that's related to the strategy in regards to supporting English language skills? So that's the first question. One for Alex. Digital exclusion, absolutely vital that it's recognised to ensure the elderly, the disadvantaged, the vulnerable aren't left behind in regards to health services and all local services in reality. And linking into this strategy from a Derby City Council perspective, will this subject of digital exclusion be linked in to an overview and scrutiny board, or will it go to Cabinet, do you think, Alex? Because increasingly AI and digital services are going to transform our lives in a positive way, especially in terms of health services. So there is a danger of certain groups and demographics being left behind, and we must avoid that at all costs. So just those 2 points, if possible.
Yeah, on the first one, I'd have to say that I don't have that information to hand. I'm not familiar with those, but I can take that away and discuss with colleagues and come back to you if that's helpful. And just before Alex comes in on that second point, what I would say is that alongside the integrated care strategy, there is a data and digital strategy within the system, which is system-wide, that will go alongside it. So it will look at opportunities for kind of digitally enabled services as exampled and joining up of data and care records, but within that as well there is obviously the recognition of the potential digital exclusion and some of the issues that are raised through that. So that, I guess, just to confirm that it is on the radar within the system.
The only thing I would add at this stage is that my understanding is that in the portfolios that the leader announced at the annual meeting, customer inclusion was included within Councillor Paul Heselgrave's cabinet area of responsibility, and my understanding is digital inclusion forms part of that. So aligning that to the scrutiny boards, the most obvious scrutiny review board who will be scrutinising Councillor Heselgrave's portfolio area will be the corporate services scrutiny review board. There is a piece of work ongoing at this moment in time to rename some of the scrutiny review boards to better reflect the new cabinet portfolio titles and some of the themes that have been raised through that. But my understanding is that digital exclusion and also AI is something that is high on the agenda of Andy Bramall as the Director of Digital Services, and therefore will also form part of Councillor Hazelgrave's portfolio and be scrutinised at corporate services scrutiny.
Thank you. Unless there's any other questions or queries, we'll move on with the one recommendation from Councillor Wright.
Sorry, Chair. Just a minor one. I can't find the page, but in the document it refers to the Equality Act 2012. Just to say the Equality Act is 2010. So, yeah.
Thank you for that. I'll take that away and make sure that that's amended. Thank you for that.
Thank you.
We were close. A couple of years out. Right, so you got the recommendation from that one. We'll move on then to item 10, which is the dedicated schools grant management plan. And I'm guessing it's Pauline.
You guessed right, Chris. Chair, sorry. So, yes, I'm bringing this paper here, I suppose, on behalf of the whole local area SEND system. This is a rather huge programme, and it's for two reasons. One is because there is a requirement under the conditions of the grant to demonstrate how we are increasingly spending within our means and bringing the at least the in-year balance back into positive figure. But the more important thing is that we actually review our SEND services, or continue to review our SEND services, and that actually we get better value from the funding that we have, to ensure that we have the right support in the right place at the right time, which is in line with the national review of SEND and AP. So underpinning all of this is that ambition for every young person to be in the right place with the right support at the right time. There is a requirement. What I'm asking is an approval for the DSG management plan, which will then continue its journey to the Department for Education, where we have an initial meeting next Wednesday with colleagues from the Education and Skills Funding Agency to discuss the plan in detail. The plan, the behemoth of a plan, is on an enormous Excel spreadsheet which is provided by the Department for Education themselves, and that is a version that is currently with the DFE. That's not something that we could obviously share in this report, but we've attempted to give enough detail for you to have the information required to make a decision, but to sufficient that you can that you're not dragged into every line of the Excel sheet. Of course, other colleagues have been, which obviously includes crucially our Section 151 officer, Alison Parkin, who is chairing some of the groups and boards that oversee this work. So I just want to reassure you of that. So we do note there's a maximum mitigated deficit of 9.782 million by the end of 2027, against an unmitigated deficit of over £30 million. But the important thing is that the balance is, the in-year balance is brought back into the black, and that we are, you know, demonstrating to everybody that we're spending within our means, and setting that then 4.5 onwards. I've set that in the national picture, and there are some absolutely huge deficits across the country. For that reason, the government has put into place 2 national programmes. One I've set out, the Developing Better Value programme, and the other the Safety Valve programme. And if you look in 4.7 on those Safety Valve programme, I've highlighted some of the recipients of the funding there. But if you look at the scale of some of that, for example, Kent, to wipe out a £142 million deficit just in the high needs block within the deficit, within the dedicated schools grant, etc. And they have had to achieve this. They have had to present a plan similar to the one we've produced here, that shows how they're bringing their spending back into the in-year balance by X year. Kent, absolutely. Just in case you were feeling bad about our numbers, Kent's always the one to make you feel a little bit better. But it really is important that we understand that this journey began a couple of years ago, that transformation in the system has involved creating more new places for children with additional needs, special needs in Derby. In Derby, for example, the expansion of St Giles with the Hive down there by the cricket ground. This has all underpinned this programme, and we continue to look at every opportunity to get best value and better outcomes. And so we did begin that work on the high needs transformation as set out in 4.8, with support from Empower, who are national partners, very much working alongside the DFE and with other local authorities, and bringing in a range of tools and systems to help us to achieve better outcomes, again within budget. So we did enter a deficit position, and we are looking at the local demand. We're looking at the national picture as well, and some national data was released just this week. It hasn't gone into this report, but there was a 9% increase in the demand for education healthcare plans nationally, and there has been huge pressure put on the completion rates for EHCPs nationally. It's fallen by about 10% in terms of meeting timeliness. So we're in the context is a challenge nationally. And so there is the national SEND review, and that is now beginning to translate into regional groups that will be commissioned by the Department for Education to look at how do we do more of this, everything that's within this plan, and what's happening across your region, how can we learn from each other. And the intention is that they are developing strategies so that people can learn from each other, best practice, and before they put any new legislation through, the SEND legislation through, which isn't what happened in 2014. The legislation came first, and then how to make it work came after. So I suppose we do have to be grateful for that. Moving on, supporting activity within the DSG plan, and there is more information there. And I'd like to highlight a huge amount of work has already been happening across the whole system. This is not just the council, this is schools, SENCOs, working with parents, the NHS, social care, to introduce that first phase of activity. And then there is planned work within the second phase, and there are huge streams of work there, for example, strategic review of post-16 provision. Moving on, public and stakeholder engagement obviously has been deep and extensive, and the governance essentially, and I think this is really important to highlight, the governance of this plan. Dedicated Schools Grant is overseen by Schools Forum, so it will be monitored there. It will be reported in and scrutinised by the Derby Area SEND Board and also by the Section 151 officer who's chairing the DSG management plan, subject to scrutiny as required, and the plan will be monitored essentially as it is a DFE plan for them and uses their template. We look at the finances there in 8.2 and they are echoed in, we felt it would be useful to have an appendix, perhaps a more user-friendly description of what we're doing in that PowerPoint, but there you can see the planned end-of-year positions and the mitigated and unmitigated forecasts. Understanding, of course, the climate implications, which are fairly positive because quite a lot of this plan is about maximising the use of existing space in maintained schools so that as appropriate and with full parental consent and agreement, and for children where they can consent themselves to moving into that mainstream school, but within a specialist class taught by their specialist teachers. And that is an excellent use of what will become increasingly surplus places in the secondary sector. We have had 30 expressions of interest from schools, both primary and secondary, over the last couple of weeks. They're very excited about this, how this actually helps us to create a city that's a city for everyone and not a city where some children go to school over there and never ever meet children who are in a mainstream school over here. And then society expects us all to get along, work and live together when we haven't grown up together. And I think this goes some way to supporting that. So just to say that it has been co-produced, it has been developed in the context of the national agenda. We've set out the figures, we've set out what the current pressures are and what we want to achieve. And we at heart believe that more children should be educated in Derby, in those placements, and not in specialist out-of-area provision, except in some cases where there are some children who do need specialist medical and clinical provision, which might only be available outside the city, and we absolutely would always want to support that. And again, we also want to increase the number of children supported in mainstream, and we do need to look at the cost there, as we are the highest, we pay the most per pupil across the East Midlands region for supporting children with additional needs in mainstream schools. But again, it's about, are the outcomes good and how can we improve that? So I obviously am here to take questions, comments. Thank you.
Thank you, Pauline. Can I just have one quick one, because the main point I wanted to raise, I note that Derby's not been invited to join either programme, at the national programme yet. Should we read anything into that? Is that positive, that they don't think we need help, or is it come in, or should we be fighting to get on one of these programmes?
I think it is positive because, you know, they would say, actually, you know, you've done well to stay within the budget for this number of years. But as we discuss this plan with them, we might welcome an invitation if it means additional funding. We're not going to turn that down, and we'd be very open to that. Yeah. So we'll have that conversation with them next Wednesday and see if they would like to shift this plan, not presupposing it's approved, but shift this plan into a programme.
Thank you, Chair. The unusual underlining that we have in a report was what I was going to ask about as well. In that, but put it into the context in a way in which I think that Derby is a bit different, just Kent has its differences, which is the number of neurodivergent children we have in Derby seems to be significantly high. And I personally think that this is because it is related to genetics in part, and the number of people who have come to Derby with engineering as their purpose. And it enables adults, even if kids may struggle, but it enables adults to really concentrate on something which may be solving your aero engine problems or dealing with something really specialist in the rails area or whatever. And as people have come to Derby, and as it has this genetic element to it, that is one of the reasons why we are a hotspot for this neurodiversity. And I wondered whether this is therefore something that we could be offering the DFE as something, if that's what they're still called, as something which we could be doing more work on and we could be learning from, and therefore something that they might welcome that cooperation and helping us do that. That's my first point, Chair. My second point was okay.
Thank you. Just keep it all in my head. I appreciate that. I think that would be an interesting piece of work. I've heard that hypothesis before. There is a counter-argument, which is most of the people who work in those industries don't actually live in Derby, but outside Derby. So I do think it would need a fact-finding. It might be something we could do with the university, and we now have a new chair of the Area Send Board, Dr. Jerry Cadena of Derby University. So we have very good links with the uni. So absolutely happy to discuss that at Send Board and pick that up, Lucy.
I think it's a historic thing. So when Derby was smaller and people travelled less, that's when they came. You know, going back the last 100 years. The second point is the number of young people who are out of education, who have no school place at the moment, who have no alternative place provision, who are left at the moment with potentially some sort of family support for their education, but quite reluctantly. And I was wondering what the numbers of those people are like, those young people are like at the moment, and how they are going to be engaged with as part of this vision going forward.
I suspect there are always going to be difficult placements to be had. I don't know if the numbers are particularly high or low at the moment, Pauline.
Right, Chair, I don't know the number, but sometimes parents choose to, as they're waiting for a placement to be agreed or approved or a process to be gone through, choose to keep children out of the other school. I can find out the figures on all of that for you, and sometimes it is difficult to place a child. They may have very specific needs which are, you know, harder to place, but I will absolutely find out that information.
Chair. Thank you, Pauline, for your report. Quite insightful. You ended your presentation by asking the question, are the outcomes good? It is paradoxical somewhat that the provision that our education provides for our future citizens, really it's always difficult to put a cost to it, and the reason why we're in this situation of deficit, as you quite highlighted. There's the aftermath of COVID, we hear through the media on a daily basis how that is impacting children and young people, those that are going through nursery, secondary and so on. And it will be a long while before we know the full impact of that and on children's social and educational development. There is also the case, Pauline, that if you look at the indices of deprivation in our society, those that are likely to end up homeless, end up in the criminal justice system, end up not able to gain employment, etc., they come from a SEND background. So if we can intervene at the critical time of children and young people's education, we can prevent the millions, if not billions, that we spend when they become adults. So I really commend you for what your service is doing, and really lament the fact that you are placed in a position of having to cut or make cuts and savings when really we shouldn't be doing this, because there is a need for the service. Thank you.
Okay, thank you for those observations. I don't think there was any direct question or point there, but certainly noted. Any other comments, questions, or we can resolve to note this report? We can note it. Thank you very much. Thank you, Pauline. Can I just ask a question? Are we likely to be graced with your presence again in the future, or is this potentially? No. Well, in that case, just from an exec scrutiny's point of view, or the chair of exec scrutiny, just a vote of great thanks for everything you've done for this authority over the years. You've dragged us back up kicking and screaming in so many different fields. It's been marvellous, and we can only wish you all the best in your future, whatever it is you're doing, and wherever you're moving on to, you'll be missed. But good luck to the future, and thank you.
It's been a real pleasure. I think some of you might know I'm a main carer for both my parents who live with me, so I'm looking to work part-time, so currently looking for something that's not 5 days a week, but in the similar field, and certainly with children and young people.
Good luck, and thank you for that. Good. In that case, we'll move on to the budget and policy framework and the final accounts for 22-23. Are you going to give us a rundown on that?
Thank you, Chair. So this report outlines the following main areas. The revenue outturn position is outlined in section 4.1, with section 4.1.5 giving a summary table by directorate. There's a 13.665 million overspend mitigated by the pay and inflation reserve, the remainder of the COVID reserve, and finally the budget risk reserve. There has been an improvement of 1.462 million since quarter 3. Section 4.1.9, going a bit fast, shows a summary of the outturn across 6 main themes. For example, pay award net pressure. It also shows the movement from quarter 3. Detail is shown in Appendix 6 by directorate and theme. So there's a lot of detail in Appendix 6 if you want to go to that, look through that. The capital outturn is summarised in 4.6.2, showing a spend of 106 million, with details of and associated narratives of the main variance to the latest budget outlined in Appendix 3. Section 4.7 outlines the TM outturn position and the associated indicators that the Council have complied with. 4.8 gives a brief update on the HRA position with key variants as outlined in Appendix 5. 4.9 outlines the DSG position with the detail following on from that. And I would like to draw your attention to section 4.4 of the report, which outlines some sundry debt and residential care debt that requires write-off of £273,000. This information has been anonymised, but the reasons are outlined in Appendix 7 of the report. I don't intend to go through any detail in the report, but I'm happy to take questions. There is a lot in there to get for people to get their heads around. Thank you.
Okay, thank you. Very succinct. A very detailed report, very many aspects to it, a lot of which have been gone over in detail in various forms and formats, and I note the slightly improved position, but also the extent of the use of reserves to cover off what has been an extraordinary school year, effectively, and this end of year report details that. So there is a lot in the report. Is there anything anybody particularly wants to highlight? Drill down into? No, I think it's safe to say it's been an extremely tough year. All sorts of unique factors towards it. The budget process was what it was, and I'm sure the new administration will be entering into a new budget process extremely quickly to cover off the position going forward, and this scrutiny board will have a chance to scrutinise that at various options going forward, at various times going forward. Anybody want to highlight anything specific, or should we note the report? Note. Thank you very much. Good. Okay. So, turning the page. The compliance with contract and financial procedure rules. So there's one in relation to permission to bid for some swimming pool, some government funding for swimming pool operators. Some funding released by central government, I think particularly in relation to expanding utility costs for local authorities, and we're bidding in.
It's a combination of both revenue and capital. The revenue is to support with costs, and the capital is to invest in more energy efficient facilities in the medium to long term.
Okay, so why would we not bid into that, I suppose, is the question. And there's delegation there if the approvals are made and we're awarded some funding, yeah? We okay with that? Lucy?
Is regarding the second point, in terms of the use of the reserves, I was the budget risk reserve for Beckett-Well. How much is left in the Beckett-Well budget risk reserve, and why do we feel that this 50,000 is no longer needed?
I don't know if there is a specific Beckett-Well budget risk reserve. I think it's a general reserve. It's to cover the costs of looking at this, entering into a strategic development partner, which is one of the things I think should be on the forward plan, but there's another story. My question on it is why there's the pilot funding that we got as a city, didn't we, from government? Could that not be used to fund this work?
Yes, Chair, I can look into that. The reason there isn't a specific Beckett-Well reserve, there was a commitment within the budget risk reserve for Beckett-Well that's no longer needed, so that's the one that's been identified to fund this. But I can certainly take that back and look at the pilot. I don't think it would be in time for tomorrow, but we could do some movements around that, but I can get you an answer back on that, Chair.
It's still 4.2.1 says, following a review of current commitments against previous allocations from the budget risk reserve for Beckett-Well regeneration, that's where I got that from, Chair, associated feasibility and revenue costs, the amount required for Beckett-Well regeneration can now be reduced. So I was just wondering why. It would be nice to know why it's able to be reduced. And I think that, I personally think that Cabinet should be reassured that that is no longer why that is no longer needed.
I think you can probably assume that that has been considered. But do you know any detail of what the £50,000 is going to pay for?
we're taking it from Becky, what it was going to pay for originally and why they don't need it any longer. No, but I can find that out and email that to you. Yeah.
That deals with the contract and financial procedure matters. So item 13 is the council house optimisation.
I get told off for shouting sometimes, and I'll try to moderate my voice. I'll start again. This report raises awareness and gains support for phase 1 of the Council House Optimisation project. This project forms part of the asset rationalisation programme, which was established in autumn 2022 to look at rationalising buildings across the council's portfolio. Some initial work under that programme identified that optimising the use of the council house was the priority. That was for several reasons, which are set out in paragraph 4.2. I'd like to draw the board to perhaps two key points. Is that the move to hybrid working has reduced the utilisation of the council house, and under the 23-24 MTFP there is an income target of 140k from rent to be generated through the council house. The focus of phase 1 is to reconfigure the first floor of the council house to create a working environment which supports hybrid working and allows spare desk capacity to be made available to be rented out to partner organisations. We recognise that this phase 1 will have an impact on how colleagues, members and partners use and view the council house. Its success relies on getting the support of these stakeholders, and this paper is an important step in trying to socialise and gain support for these proposals prior to entering into any medium-term legal arrangements and forging long-term plans of how the building is used. Moving forward, the programme team want to focus on bringing in public sector partners and other health-related organisations who already work closely with and where we see huge potential benefits in co-locating with both parties. We started this process by granting initially a licence for 30 desks to a public sector health partner who will join the police department of work and pensions and Derby Homes and others who already share the council house. Initial feedback we've had from people services colleagues on the first floor indicates that this relocation is having operational benefits, and that's only for 30 desks. The other aspect, I think, of phase 1 is to try and address whether the council house is set up optimally for hybrid working. Initial feedback is there are barriers to collective working here. You know, there's insufficient meeting, joint working areas, smaller private areas which hold team meetings and one-to-ones. And we're looking to address this in a couple of ways. In the short term, really to take practical steps, we're trying to bring back into use a number of meeting rooms that have been repurposed during the pandemic, and also look to use some of the cabinet member offices which are being released. Concurrently with that, and more sort of medium term, is prior to us to take any significant session change in the way we work in the building, we need to take stock. Therefore, we're looking to ingest a survey for the heads of service to seek their views of how the building should be used. And also we want to seek to bring in external support from an office planning professional to better understand how the market is at the moment and the range of opportunities available to us. The other aspect that supports this phase 1 is that the Derby is part of the Place Pilot. This is a central government initiative driven through the One Public Estate programme to bring together all public asset owners in each place to deliver a more joined-up approach for future public estate demand and supply. Obviously, bringing public sector partners into the council house will be a central contribution to our Place Pilot work, and we are seeking to fund a lot of that initial feasibility work through the grant already allocated to Derby as part of that pilot. We recognise that there are risks associated with around this phase 1, mainly because it's a vision and at early stage. However, we do recognise that we have to move quickly sometimes. The agreement we entered into with the health partnership we have to act quickly and seize opportunities as they arise. And for that reason, the programme board want to remain agile in the decision-making process, and therefore have sought the recommendations set out in paragraph 2.1 and paragraph 2 to help support that process.
Okay, thank you for that. It may well be that we, as a scrutiny board, could endorse the rationale for it, because I think we're all very conscious of the lack of optimisation of the work of the building and the lack of numbers involved. Can I firstly ask, there's some confidential item at the end of this meeting. Can I ask why it's deemed confidential? I know that the new leader of the council is very keen to reduce the number of confidential items that are held at Cabinet and the council in general. Prejudice your stance in relation to further and future partner agencies coming and joining us, you mean? Councillor Khan?
See, I would want to know maybe at a later stage, the partner agency, who are they going to be and which agency, because obviously the council is the desk downstairs are there to provide a service to the public. So that service to the public needs to be there, and if it's a private sector organizations or agencies, are they going to be really meeting the need of the public out there?
So the question is private or public agencies?
Well, obviously what we're trying to focus on, I think, is, when I say desks, I mean desks on the first floor where staff use the system. It's not at the moment anything on the public ground floor facing desks at the moment. We're not looking at that. That may be in future things. But we are focusing on where we work, where partners already work with us, but those partners are located in other buildings. Bringing them into the building will help cooperation work with other council officers. So that I can explain a bit more when we get to the confidential paper, because I can name some of the groups. But it's public sector. So it's a public sector health body who've come into the council house and are working, who are existingly worked with council colleagues.
Chair, I do understand that it will generate some money, bring some money in from the private sector or the third parties, yes. But I think that's where we've got to make sure that the council house remains, has a public service, and the other rooms upstairs, meeting rooms and all that. Yeah, that makes sense. Thank you.
Yeah. Understood. Thank you.
I think so. The feedback there is it's maybe acceptable, but it doesn't affect the potential for us to deliver our own services from here. Got a couple more hands. Councillor Holmes first.
Thank you, Chair. I won't over-egg the political point I'm going to make, but in 3.3, where it says there's a market, the market interest in renting space in the council house offers Grade A office space, is in generally in good condition and boasts excellent green credentials. That is a result of a decision that was made by an administration that I helped to lead. You were a cabinet member. Councillor Ling was a cabinet member as well back in 2010 and 2011. Conservative-led administration. I was deputy leader. Labour opposed that decision, and it just shows that sometimes you make the right decision and do the right thing, and this is a result that we can actually exploit the council house because it's a fit-for-purpose building. We made the investment back then, and we are able to take advantage now, Chair.
Thank you. Political point well made. Councillor.
Yeah, thank you very much, Chairman. I've got a couple of questions specifically around the data gathering and the benchmarking for this, because before we start, kind of divvying up the floor and giving it out to a third party, I really think we need to make a concerted effort to try and get people back into the office who work for the council for a majority of the working week. So I'm not suggesting draconian go back to working 5 days in the office a week. That's not the world we now live in. but every time I've been in this building, there's nobody here. It's empty. Ooh. It's empty. And I remember on my very first training day, having a conversation with Councillor Bolton, and she said that the buzzers left the building. There's no one here. And I'm, you know, we're all getting paid by the public here. You know, I think that if they could see just how few people there are here, they'd be pretty concerned. So I think that before we start, you know, trying to optimise this building, we should be looking at trying to get as many people back into here for a majority of the week.
I think you work at Rolls-Royce, don't you? What's the arrangement in
I do
other
indeed.
In relation to joint working?
So we have hybrid working at Rolls-Royce, and it's expected that we'll be in the office for a majority of the working week, so that would be 3 days. My team specifically, we're in the office either 3 or 4 days as a minimum. And we've seen a pretty substantial increase in our productivity because I think working in the office enables you to have those quick conversations that unfortunately working from home requires an email, which someone ignores for 2 or 3 days and then decides to eventually get back to you. I think we're missing that at the council house at the moment. I think it'd be really good if we could get it back.
Can I just kind of raise, and I don't know if I can say this in this section, but I understand there's one health part of the health organisation already in the council house. Can we name them at this point? It's Home First, isn't it? I'll make the decision. Home First already here, and there's a danger for me here that if they come here to use our facilities and fantastic opportunities for closer working, for revitalising the city centre, etc. But they could come here, and that the people that they work with, or should work alongside at the council, are not here. They're working remotely, or working from home, or doing joint working. So, whilst I think we can endorse the policy, if you like, I think it needs to be looked at a bit more carefully, because I don't think we fully understand the level of hybrid working and remote working that is happening in the council house. And I don't think we've set a strategy for optimising the council house for our own staff before we start bringing in and filling all the chairs with other people. Your observations on that?
Yes, we do recognise that as an issue, because we can't give away space if our staff want to use it. That's the fundamental. And as part of that initial work is we've got a survey going out to heads of service to see what their requirements are across the council house. As part of that review, we then take the next stage and say, actually, how many spaces are available we can offer to partner organisations. So we do recognise that that is an issue, and we're not in a position to say definitively we are going to let out percent of the council house now. We don't know that, but this is the first step. We want to try and do a phased approach, and this is phase one.
But that work needs to be done because for everybody's advantage, for the public, for ourselves, and the optimisation of the council. Councillor Wright.
Thank you, Chair. In terms of flexible working, those of us who've been in education wouldn't be able to provide our educational service if we didn't work flexibly. So I really welcome the flexibility, and we know from anecdotal, well, no, actually not anecdotal, from actual evidence that productivity is going up because people have that flexibility in terms of whether they're in situ or they're working from home. In terms of hiring out, subletting the building, I think we ought to give some consideration to the image that this will create for the public who see this building. It has significant symbolic meaning, the seat of our democracy, and so on. So I think we need to be very, very careful about the extent to which we go in terms of subletting. I see perhaps the financial aspect of it, but I think there should be other considerations.
Yeah, I think we're going to talk about the finances in a bit more detail in the confidential bit, but yes, Councillor Ingle.
I was just going to say, Chair, you will remember as well as I that Derby Homes used to rent the top floor of this building, so all we're doing is going back to what we've done before, so I don't really see any type of problem at all. Let's just get on with it.
With certain caveats, I'd agree. Councillor Bolton.
Yes, Chair, thank you. Obviously, the practicalities are we need to get investment to pay for the deficit we have as a council, and this is one way of doing that. But I take on board what Jamie said at our first day of induction last month. We were all amazed at how empty the building was. And I can recall, when I was on the council previously, people couldn't get desks. They were sitting in the quiet areas because all the desks were full. And now, and I take on board, obviously the pandemic has had repercussions on everyone's way of working. I appreciate that. But this is, as Cecile said, this is a public building. Some of my constituents come in here and they're amazed that they can't speak to anyone face to face. You've got to get them on the phone or on a Zoom call. And they think walking into the council house now, apart from the fact that in the afternoons there's no one there to greet them, because obviously our reception staff now don't work in the afternoons, what does Derby City Council do? Because downstairs is the library and DWP, which we knew about. And as Phil has just said, the top floor used to be Derby Homes. So theoretically, yes, we have been in this situation before. But I think we need to get some of the staff back in the building because that is what they're here for. That is what the public are paying their council tax for. But on the whole, obviously bearing in mind the report, and particularly on page 3, item 4.8, where actually the cabinet members are leading by example. They no longer have their own rooms, they're sharing, and in one case it's 3 to a room, not 2. So we are trying to lead by example and thereby make sure that there are spaces available should other partners want to come in and use the rooms or meeting rooms or as outlined on 4.8. On the whole, I agree with it, but I think on the other hand, we've got to make way for the public to actually come in and speak to an officer because we are here to deliver services and people like that face-to-face contact.
I'm sure Councillor Hesgrave, whose responsibility it is now, will have his own views and actions planned for that. Cecile, I would take issue a little bit with the premise that with flexibility comes more efficiency. I don't think there are obviously examples of that, but there are also examples where that's not the case. And I think that needs to be carefully managed by the managers, if I'm honest.
Yeah, happy to supply you with the statistics, Chair.
And no doubt that we could supply some counter statistics. Councillor Hall was first, and then Lucy, and then I'm going to wind this up.
No, I was just saying that I agree predominantly with what Councillor Bolton said, but, you know, if we maximise how many people we can get back into the office and there's still space, and if we can make some extra cash for the council with that, I think we should crack on and do it, regardless of whether we're the hub of democracy for Derby or not.
Councillor Kerr?
I just wanted to put the point that our purpose is to provide the services, and if those services are provided as effectively or more effectively from working from home, then that is where people should be working from, because we haven't got the finance to have the luxury of saying everybody ought to be here and it ought to be a buzzy building, if what we actually want is services provided as efficiently as possible, and that is from home. Certainly talking to planning department, they seem to feel that there is very effective work happening from their planning officers being based predominantly at home. But the other side of that is that I think that there are skills that managers need to have to build teams, particularly when people haven't got to know each other in a real life situation. And I think makes us vulnerable to the efficiency and the functionality of our IT to be able to have a quick Teams call to somebody rather than meeting them at the water cooler, as it were. And I think if we haven't fully looked at the risks associated with our IT not being fully functional, and particularly if the phones are going down as well, which has happened, then I think that is an element that needs to be borne in mind.
Okay, I think the balance is the important thing here. I would take issue with the planning side of things. It might be, they might feel it's more efficient, but if I had £1 for every time somebody's contacted me about not being able to contact their planning officer or get a decision or whatever, then that efficiency is not, that side of the efficiency is not there. It's not helping people working from home because they're not contactable. And I think that's something that should be addressed. Councillor Ingle, did you want a final word on this?
Yes, if you don't mind, Chair. I think we need to just balance this out here, because we're saying about getting people back into the office. That's something that the head of the paid service should be deciding, Paul Simpson. It's not for us as elected members to decide how staff work in this building. And I think we need to distinguish that, because we can't influence that. That's Paul Simpson's job as head of the paid service. Thank you, Chair.
Technically, you're right, but I can assure you that it's not something that's gone unconsidered and not being thought about and actions taken to try and redress the situation in the past. But I'm going to try and sum up the mood of the board in relation to this in a recommendation. And along the lines of, as a board, I think we can endorse the principle of optimisation of the workspace in the council house. But we need to understand the extent and the issues around hybrid and home working to be able to ensure that we can maximise the premises for the purposes of which it was originally intended, i.e. bringing people back to work and filling up with our own staff in an efficient manner. Is that okay, Stephen? You got the gist of that? Is that anybody would second that recommendation?
I'll second it.
Take a vote on it. Those in favour of that recommendation? Any against? Okay. Recommendation in relation to that then. I think that concludes the formal agenda. But I just have to consider a resolution to exclude the press and public during consideration of the following item, that under section. Oh, we've got. Oh, sorry, I'm missing our Sarah. I missed the part of the performance monitoring. I'm sorry.
Thank you, Chair. No problem. So this report presents a consolidated overview of performance in line with commitments made in the Council Delivery Plan. So it brings together 63 milestones and commitments, 57 priority performance measures, 39 projects and 15 strategic risks. And this report reflects the end of Q4, which is the end of March 2023. There is a supporting appendix, Appendix 1, that gives you details of all the milestones and measures, projects and risks with supporting commentary. But I'll just go through some of the headlines outlined in paragraph 7 of the Cabinet report. So just to summarise, of the measures where targets have been set and were monitored, 72% of these met or exceeded the target at the end of March. That's actually 7% higher than the 65% reported last year. At the end of March 23, 73% of priority milestones where an update was provided were assessed as on track or completed. 67% of priority projects being monitored as part of the council plan have been evaluated as either green or amber green, and that was following targeted assurance reviews on progress and delivery. This position is below the 81% reported at the end of March 22, but it's actually a result of more robust challenge and more assurance activities that have come in place over the last year. There were 15 strategic risks, and within the strategic risk register, and since the end of December, it should be noted that one risk has been escalated from directorate to strategic risk level. So within the report, paragraphs 4.8 to 4.10, this highlights key achievements set out, which includes completed milestones, which there were 12 last quarter,
and reduced risk scores due to mitigation. So just to briefly summarise some of these key achievements, these cover areas such as new jobs and businesses supported, funding generated, recycling rates, housing quality improvement post-interventions, and attendance rates, especially amongst Derby Live, maximising the use of Derby City Council foster carers, and collection rates of council tax and business rates. There are a number of areas for improvement which are detailed in paragraphs 4.11 to 4.15. And that includes a summary of the milestones where there has been slippage, alongside all measures where targets haven't been achieved, and there is supporting commentary to give context to that. The key areas for improvement are homelessness. There is an increase in approaches with homelessness, and that's been impacted by a number of factors, including the private rented sector and lack of suitable properties. Stability of placements, as well as working days lost due to sickness absence. A number of performance review activities have occurred over the last quarter, and they're highlighted in 4.16 to 4.18. So the board is asked to note 4 key points. So the recommendations are to note the latest performance position, paying particular attention to the latest profile of our strategic risks and emerging priorities for improvement. To note the in-quarter activities set out in 4.16 that have been completed to provide assurances on our strategic risk controls, with further activities scheduled for the coming year. To note 2 performance measures that are recommended for consideration via a performance surgery, and they are in relation to the stability of placements for looked after children, both length of placement and number of moves. And then finally, just to note that the findings of the Data Quality and Performance Management Audit Report that was published in March, presented in paragraphs 4.19 to 4.21, which found there to be substantial assurances in our processes. And that's the summary from myself.
Thank you very much. Again, a very detailed report and deep dive into our performance, highlighting some very positive things, but also some things of quite serious concern. Just repeat for me the 2 recommendations for performance surgeries. One was stability of placements for our looked after children.
Yeah, they're both in relation to stability of placements, one in terms of the length of placement and one in terms of the number of moves in the last 12 months. They've both been increased in significantly.
Okay. We have got 1 or 2 new councillors here and some returning councillors, and whenever I look at these performance reports, there are certain things that jump out at me, and one of those is always sickness and days lost to sickness. But also I'm slightly surprised at the outcome in relation to rough sleeping and homelessness, because there's an awful lot of resource been put into that over the last few years, and government's help and support, and we made significant progress. Who will be looking at that, and any lessons we need to learn or new challenges? You said various reasons. It strikes me as something that the Scrutiny Board should and could look at. Is there any plans for such?
Yep, it's been monitored internally through a number of different channels. There is a cost of living element to the homelessness. So each month there is a report that's produced that looks at reasons for homelessness that is monitored. And there's a separate working group that looks at the cost of living coordination groups. There's separate reporting purely on the cost of living, both demand indicators and also how successful our initiatives are within the City Council and within partners.
And sickness is the other one that jumps out to people that don't that are new to the scenario, and surprised, I think, at the level of sickness that we suffer. And I'm aware that over the years there's been all manner of efforts and things made to try and address the situation, but then COVID comes along and complicates it even further. Jamie, you're one of those new councillors. Are there any other red categories that jump out at you? Or what are the things that...
Yeah, I mean, the one around the amount of days lost due to sickness, I mean, it's averaging just short of 12, which is, well, it's quite shocking to me personally. That's an astronomical figure, really. I suppose the first thing that jumps out is obviously we've got quite a lot of reds, and the supporting information doesn't really go into much detail as to how we're going to turn those reds into ambers, what the council's going to do, particularly for each of those. So, you know, picking up on what you said, Chair, about homelessness, or another example would be, you know, people in effective alcohol treatment. You know, it says here that Derby is not an exception as the national performance has declined within this area. Well, I don't really care about the national performance, to be honest. I'm only bothered about Derby, and I want to make sure that we're doing the right things to turn these critical reds into ambers and then from amber to green.
Where is which scrutiny board actually scrutinises the performance monitoring? Is it audit and accounts, or audit or whoever? Does any particular scrutiny board take responsibility?
I'd have to double check. I thought it just came to this exec scrutiny board, as well as obviously our CLT monitor on a monthly basis.
And all these items that are in the red will fall into a portfolio or another, and performance surgeries will be recommended and reviews. Councillor Home.
Thank you, Chair. Just following on, and this is something which we've all discussed over many years, is the absenteeism numbers, or per days lost through sickness. There's no comparable data here. I believe, I might be wrong, but it's more than double the private sector in Derby. Have you got it there?
It's 4.6.
Yeah, and it's more than the average public sector as well, by probably 3 or 4 days. Is that the case? And if so, why is Derby an outlier?
Yeah, I can comment on that. So we are above, well above private sector average. We are also above local government average. There were some statistics published. The annual statistics for the UK labour market was published in April, and it does show that Derby is higher than average. Literally in the last week, a piece of deep dive analysis has been conducted on sickness absence, and a sickness management working group has been set up internally. What the trends are showing are that Derby is following the national trends in terms of the patterns, but that absence rate is higher than most of our comparator authorities, as well as the average. So that's why we've now set up this working group, just to specifically look at it.
Thank you, Chair. With respect to the homelessness, are there any indicators as to whether there might be mental health issues linked to that situation? And in terms of the absenteeism from work and health matters, is there anything that the trade unions, health and safety trade unions, might be able to assist in terms of getting some sort of analysis as what is so higher than other councils?
In terms of homelessness, I believe that when the information is captured, they do capture different reasons for homelessness. Mental health isn't a specific category on the summary report, but I can certainly take a look to see whether there's any further detail underneath that. It is certainly captured when we look at data related to cost of living, so people accessing warm hubs and food parcels and that kind of information. And I will certainly raise the trade union suggestion at the next absence management meeting next week.
Thank you. I've got one specific question and one question really about why we're looking at the statistics as we are. Maybe I've overlooked something. There is on page
3 of the main report, of the main document as opposed to the report, it has the point on contribute to the delivery of the city's climate change strategy, and says that this action will be progressed further following the formation of the new Green Board. An inaugural meeting of the Green Partnership Board will be arranged in June 2023. And I just wondered if you had any more details as to when that meeting was going to be taking place, what's the agenda going to be, who's on it, sort of thing.
Don't have any specific information about the date, but the last time I was aware it was certainly June 2023. It was discussed at the City Partnership Board that the inaugural meeting would set up, but I don't have any access to membership or the specific date at this present time. I can certainly find out for you.
Thank you, that'd be lovely. The second question is about the waste levels, and there's a target here which is about the amount of recycling, which is on page 5, percentage of household waste recycled, composted or reused, but there doesn't seem to be a measure of how much waste in total we are producing. And I think that both are important to be monitored, and I just wondered why we weren't monitoring, or does it come into a different category and I've overlooked it?
It's not its own specific category, but I can certainly find out why we've not got that as a particular measure to go alongside the recycled waste. The only thing to point out about the recycled waste is that is reported a quarter in arrears, so the figure within this report is actually Q3 figure.
Okay, so I'm going to bring this item to a close. Is there any useful recommendations anybody thinks we can make that would enhance the performance monitoring situation? I mean, we could ask Cabinet members for action plans on specific red areas, but I don't know whether people would consider that as an appropriate recommendation. So, if we resolve as a recommendation to call on the relevant Cabinet members to provide us with action plans in relation to, well, not all, we can't really do it all. I mean, maybe the ones we've discussed, so employment, yeah, sickness and homelessness, and any other.
I suppose it feeds into the homeless one, Chair, but the one about alcohol treatment.
Yes. Okay. Homelessness in veterans. Okay. Is that okay, Steve?
Yeah, I think we just need to, right. So I've got 1 here, sickness. 2 was homelessness, and then homelessness with veterans, is that right?
Veterans and alcohol treatment.
So I'm just going to, right, so that's 2. Third, one of the members mentioned alcohol. What was that,
it was something on the lines of those that are in alcohol treatment.
Those receiving alcohol treatment, is that employees? Is that linked to the sickness?
No, that's separate.
Separate.
No, it's just general alcohol treatment.
Yeah.
There's a fairly significant reduction in those on programmes.
Okay, so number 4.
I think one ought to also mention homelessness in relation to mental health.
Veterans and mental health.
Yeah.
Influences. Okay.
So we've got 3 then. There. With 3 categories.
Yeah. Okay. Good. I think
we're all in. I take it we're all in agreement.
Do we need to vote on that? We all agreed.
As long as you're all agreed, that's fine, Chair. Thank you.
Good. That does complete the agenda then, but we have the confidential item, but I have to make the resolution to exclude the press and public during the consideration of the following item, that under section 100A of the Local Government Act 1972, the press and public be excluded from the meeting during the discussion of the following item on the grounds that it involves likely disclosure of exempt information as defined in paragraph 3, part 1 of Schedule 12A of the Act, and that the public interest in maintaining the exemption outweighs the public interest in disclosing the information. Can we be agreed?